Hi guys, I'm Cynthia Tisch and I am with Dr. Tisch here. We are from Recharge Clinic in Ocala, Florida. So today we are going to be talking about testosterone therapy and the different things that you can do to replace your testosterone in men. We're going to talk about really great options for replacement and then not so great options for replacement. So let's get started, Dr. Tisch. What do you have to say about all of this?
Well, testosterone replacement or optimization is something that is reserved for people who have symptomatic low testosterone. So that's a difference of them just having low testosterone. So men who have symptomatic low testosterone generally feel quite bad. They're tired, lack motivation, energy, they gain weight, low sex drive. These are the people that we're primarily targeting for testosterone replacement.
So you're saying it's not just if their number is low, if they have these symptoms, it's an issue.
Right.
Okay.
And that's important because that number could vary from man to man. So what is a low number for one person may be a different number for another. You cannot just use the lab reference range and say, well, your lab is within this normal range, your testosterone is not low. In generalities, guys feel best between 8 and 1100. They become symptomatic. In other words, they start having those symptoms of fatigue, weight gain, low sex drive, very ineffective workouts below 500, and then they start to go down. So I can tell you most primary care docs don't really understand a lot of that, so what they end up doing is, as long as it's in the reference range, you're okay. So they'll let people kind of languish for a long time below 500 until people are basically begging for therapy before they'll start treating them.
I've seen this a lot when I do consultations. They'll circle all of the symptoms for low testosterone, and they say, but my doctor said my testosterone is fine because they said it has to be under 200. I don't understand if their testosterone is, if they're having all the symptoms of low testosterone and their testosterone is really not high, why wouldn't they treat them? Is it unsafe to do that?
No, testosterone therapy is incredibly safe. I really think what it amounts to is a lack of experience. And I can tell you from my own personal experience, testosterone therapy and testosterone, just discussing it in med school, is given maybe 10 minutes. At the end of all of the hormones and all of the weird medical things that we learn about, they'll say, and then there's testosterone, and that gives you muscles and does all of that kind of stuff. So people don't understand it. When people go into residency programs, internal medicine and primary care, they're primarily focused on treating high blood pressure, high cholesterol, diabetes, emphysema, all these real medical problems, and not generally spending any time on it. It's considered just an extra. It's not really considered a true medical problem. The problem, and that's a huge problem.
That's a shame.
It's a huge problem because, traditional medicine is great at life extension, but really testosterone affects the quality of life in a very dramatic way. And more importantly, actually, there's many studies that support really all of these things like diabetes and obesity and metabolic syndrome are all related to low testosterone. And testosterone in men starts dropping typically in our early 30s and gradually goes down. It's not an abrupt drop down. And so what that means is it's an insidious thing, and people are not really aware of the drop because really their frame of reference of how they felt is how they felt the day before, not really how how did I actually feel 5 years ago? They can't really remember that. But people around them know that they're slowing down. They don't want to take part in as much stuff, as much social activities. They may start giving up hobbies. They stop going to the gym because they feel like it's not very effective. Plus their motivation is down. And those are important things. So what happens is then, since they're not burning as many calories, but yet they're eating the same, they start gaining weight. And all of these other problems happen from weight gain, hypertension, diabetes, all of these things, high cholesterol, and it starts this process. And once you start getting into that sedentary lifestyle, it's really hard to break out of it. So then traditional medicine just goes ahead and starts treating the problem. Oh, you have diabetes? Let's treat this. You have high blood pressure? Let's treat this. You have this? Let's treat that. Instead of getting to the root of the problem and saying, listen, let's get to the root, unravel this whole thing, and get you feeling better.
Yeah. Okay. So once someone realizes that they have low testosterone, they've got the symptoms, and they're at a physician or a provider that's willing to treat them, now what are their options?
Well, the first thing that we're going to do is look at their blood work and see what their level is. And that's an important thing, just to see where we're starting from. And we want to look at several parameters. We want to look at that. We want to look at their PSA and other things to make sure that they're healthy and really a candidate for testosterone therapy. Well, really, there's a lot of options that have existed through time, but really it's honed down to really two main ones. So, there used to be an oral form of testosterone. There was a topical form.
Well, those are still out.
They still are.
People are still getting prescribed those,
yes,
right?
they are. Androgel and some of these other ones are topical testosterone gels. There's injection therapy and then bioidentical pellet replacement. Those two latter ones have been around the longest. In fact, they have been around since the 1930s.
Wow.
So if you look at the different forms of treatment and what makes some of them better than others, you say, well, I'd rather just take a pill if I could as opposed to an injection or pellets. I mean, that's the best way. It would seem like it's the easiest. You're right. It does sound it's easiest, but it's not the best, and it's the least safe. And so when you think about it, anytime you take something in your mouth and you swallow it, it's got to go through your liver, it's got to be metabolized, and then there's breakdown products. And some of those breakdown products have been associated with liver damage, liver cysts, things like that, and not really achieving effective levels. So although it seems like an easy way, it's not the most effective. Let's go to creams and ointments. Well, that seems like an easy way. Let's just apply this cream. Well, it's not even really that easy. Men have to basically slather this gel on themselves every day and then hope that it's all going to get absorbed consistently and achieve the levels that we want. It's not so much, so there's two components to it. There's one, applying it, and then secondly, is it working? Is it getting the levels where we want? So it's more than just saying, here, I'm giving you testosterone. That level or however we're treating you has to be an effective amount.
Yeah, how well does that get absorbed?
It does get absorbed, but not very efficiently and effectively. Very, very, very rarely do I see anybody who's been on testosterone gel who's had anything good to say about it. It never brings your levels up very high, and it's incredibly expensive. And the other thing, which is the most worrisome, is there's transmission of that testosterone gel. So these things are in an oil base. So you have to be careful because they get over your bedclothes, they get over towels. When you're going to hug your spouse or children, you have to worry about transferring that testosterone.
So if it got on them, or maybe even your dog, it would actually increase their levels as well.
Absolutely. If it's going to get absorbed through your skin, it's going to get absorbed through theirs.
Wow. Okay.
So we want to look at forms that are going to be both effective, safe, and pretty easy to do. So that's really when we come down to injection therapy and pellet therapy. And really those are fairly similar in the efficacy. In other words, the ability to achieve a testosterone level where guys feel good. Because that's what it's all about, is bringing them back to the levels where they felt good when they were younger. Because honestly, everyone had higher testosterone levels and they dropped. So we're just trying to bring you back to where we are. We're not trying to make men superhuman, not trying to make them into the Hulk. It's just really to bring them back to that levels where they feel good. They have energy, motivation, their mental clarity. They start losing weight because their muscles are functioning properly. Workouts are effective. And more importantly, one of the things that I forgot to say earlier is that testosterone is integral in cholesterol metabolism. And generally it's probably, and this is something that's really overlooked, probably the most important aspect of it. Guys who have low testosterone all invariably have an elevated LDL, which is your bad cholesterol. And so once you start that, it starts to optimize that and starts to bring it back into the normal range.
So instead of going on something for your cholesterol, if you optimize your testosterone, it's probably going to work itself out?
In many times. I can't say in all. But to me, when I see people who have elevated, that's one of the things that we always check, is their lipid profile. And I can tell as soon as I look at their lipid profile, if they're going to have one of several hormone imbalances that are very well known to do that. So it's not going to be something that a primary care is going to think of when they first see that, because that's not their knee-jerk reaction. The knee-jerk reaction is to see elevated cholesterol, let's put you on a statin, as opposed to let's find the way. What's causing it? What's causing it is low testosterone, and let's try and fix that and let your body work as efficiently as it did.
Definitely.
We know that it does that. We know that it does fix this because look at young guys, young men, and young women rarely, if ever, have elevated cholesterols. And so they all had normal testosterone levels. So we know that it's safe, we know that it worked, and we know that removing it causes this metabolic imbalance that causes things to be a problem. And it's just, since it's never been recognized and taught, and really because pharmaceutical companies make a lot more money on using statins, blood pressure medicine, and diabetic medicines than they do just basically testosterone, which is not an expensive form of therapy, that's what they were pushed for. And that's really what's going on.
Interesting. So, talk more about shots and pellets.
Pellets. So really, we know that the topical preparations are really not that effective. We know that the oral preparations. So there's really only two other ways. Injection therapy, they're called parenteral routes. So basically injection forms is testosterone that in an oil base, generally grapeseed oil, that's the most easily assimilated. And people get a shot of that testosterone, which it typically lasts anywhere from 5 to 8 days. Most people, get a shot once a week, and that's kind of it.
Okay.
And what the idea behind it is going to bring your level up and keep it in that range until it starts to fall down prior to your next injection, which you'll get another one before it's dropped down and you start feeling poorly, and bring your level up. And the goal is to keep it at that sustained level, that level being above where you felt poorly. So the goal is to make you feel better and feel good while you're on it. And not too high, just in that normal range. And so that's that form of therapy. So people get injections that way.
You said that they get them about every week, but a lot of people that I've talked to in consultations are actually getting testosterone shots once a month from their other provider, and they say that they don't feel good. Why would they be getting them once a month?
Well, again, I think it has to do with lack of understanding of testosterone, really being very uncomfortable with the whole process. So a lot of people are pressed by their patients to start them on testosterone therapy. So what happens is these guys said, okay, fine, you want it, I'm going to give it to you. They don't really know how to prescribe it. So they're just going to give them basically, if you were dying of thirst and you needed a bottle of water, me giving you a thimble, I'm saying, here's your water, you happy? And that's basically what they're doing. They're giving them a token amount of testosterone. If you understand the way it's absorbed and the way it works, it doesn't work that way. So, it's a medicine that only lasts 5 to 8 days when it's given by a shot. So to give something, anything that lasts longer, a period of time, anything longer, 2 weeks, 3 weeks, or a month, basically you're not helping them you're only helping them for a week. The rest of the time they're feeling miserable, and they do, and then they get their shot, they feel great for a week, and then crappy for a week or 3 weeks afterwards. And we see that over and over again. It's just not knowing how to dose it properly. So people get frustrated then. The same thing with gels. They're saying, well, I tried testosterone, it didn't work, it didn't help me, because the gels are cumbersome to use, they don't bring up the level properly, and people don't feel good. As well as getting shots that are given in an improper dosing timing frame, you're not going to feel good either, so you're going to actually feel worse. And we realize that this hormone replacement has as much as a mental component as it does a physical component. So you're having these ups and downs, which are not doing you any good. And so that's why people don't do well in that form, in that period.
And speaking of the mental component, a lot of people seem to be afraid that getting testosterone therapy replacement is actually going to make them angry and have a bad temper and act out. Is that the case?
No, that's a common misconception, as there are many misconceptions about testosterone. But testosterone is actually very sedating for men. And when I say sedating, I don't mean it makes you sleepy. It's very calming. It has a very calming effect on guys. So even if you see people who are taking very high doses of testosterone, bodybuilders and such, they don't have any rage issues or anything like that. They're not out there. They talk about all this roid rage, and they always put it to testosterone, but it's never been associated with that at all. It actually has a very calming effect. And there are people who have anger issues when they take other steroids, but it's related to those, not the testosterone. So most people are very calm on testosterone, and they actually feel a lot better because they don't feel so bad.
Okay. So let's talk about pellets.
So pellets therapy has been around, again, since the 1930s. And really what these are bioidentical hormone pellets. What does that mean? Bioidentical means that hormone, that testosterone, has the same chemical structure as the testosterone in your body. These are plant-based, so in other words, it is derived from different plants, but one of the most common one is yams. And they take that chemical from the plant and they reconfigure it to a testosterone molecule. So what happens is now, in the powdered form, they are compressed together into a pellet. It looks basically like a grain of rice. Those pellets are then inserted under the skin, basically what's called the subcutaneous tissue. It's right under the skin. And in guys, they're generally put in the upper portion of their butt cheek. And once they're under the skin, they build blood vessels around them over the next several days. And as the blood flows past, it picks up that testosterone and it brings it up to a level. It stays at that level generally for about 6 months and then drops. And so it's a very convenient way of doing it because you only have to do it once every 6 months. The nice thing about pellets compared to maybe shots is that it's much more physiologic. And what does that mean? So people who are very active, the blood flows past faster, it picks up more testosterone, which is much what happens to us naturally when we work out. Our muscles release more testosterone, and then when we relax, it calms down. And so in that way, it delivers the testosterone really just as you need it.
That's really cool.
It is. There requires no metabolism of that testosterone in your body to break it down to the active form, and that's what the bioidentical means. So in other words, it goes very safe. It goes right to work.
Okay. What about so when you insert these pellets under the skin, is this a surgery? Like, how long are people down for? How big is the incision?
Yeah, it's an office-based procedure. Basically, it's done with local anesthetic. There's a small amount of local placed under the skin, and then we do make a tiny stab, which sounds like a surgery, but it's not. It really is very small. And then there's a trocar, that's what it's called, to insert them. It kind of looks like a straw. It goes under the skin, and the pellets are pushed in under there, and they're fanned out, not next to the incision, a little bit further out. And then really, it's not stitched closed or anything, and we just put a Band-Aid over that stab. And like I said, over the next several days.
And that's not a painful procedure? It's
not painful because we use local anesthetic. The next day, some people experience a little bit of soreness, but it's not bad. Really, they have a few restrictions, basically, as far as exercising, as far as squatting and things like that, just so that the pellets will stay in place and kind of get locked in there. And then after that, they're able to resume their activities, and that's it. They have no problems. They can swim, go in pools, do anything. You do not feel them under the skin. That's another question that people said. Will I be able to feel them? Will there be bumps under my skin? Absolutely not. You cannot feel them. They're fairly small, and when you put them under the skin, you can't feel them at all.
So which forms of testosterone replacement do you use in your practice?
Basically, we use shot therapy and pellet therapy because those are the most effective. And that's really what we want to do. I mean, really, there's no point doing other ones as a system of trial and error. People come here, they're already desperate by they come here. Many of them have already tried other forms of therapy which have been unsuccessful. So they want to feel better. We want to give them something that has been proven, tried and true. It's almost 100 years that these things have been done. So it's nothing that's just really new. And so they've been done for a long period of time. We know that they're incredibly safe. They have been studied so much, and it's very safe. So why not do it and help people feel better again?
Yeah. So going back to when you said that you look at people's labs and you see their testosterone, and guys feel good between 800 and 1100. What about free testosterone? Like, what's the difference between that testosterone number that you're looking at and then free testosterone?
Well, this is something that is, wasn't always available to everyone. It was just total testosterone was the only thing that was available. And so in that way, that's when we had to use that guide of 8 to 1100. That's really just an estimate. Really, now we have the ability to dive much deeper and look. So there's a protein that carries around testosterone, and it acts like a sponge as well. It's called sex hormone binding globulin. It's a big, long word. But basically, testosterone is carried around their body with that. Now, what leaks off of that, once that protein is saturated and what leaks off is called free testosterone. And so that's really the important number, the amount of protein someone has and the free testosterone. And it's really akin to thinking about if you were to pour water through a colander. And when we're young, most people don't have a lot of protein when they're young. So you would pour in a cup, and say the bottom at what you're going to catch is free testosterone. You pour in a cup, you get a cup. As we get older, you start putting more layers in there. And some people have a lot of layers. They have a lot of that protein. So it may almost be like there's a towel in there. So you pour in a cup, and you may only get a third of a cup. So it's very important to look at that, because that is going to help you guide what their testosterone has to be. Someone who has a lot of protein needs a higher level of testosterone, total testosterone, to get a higher level of free testosterone that's going to be in that range.
If they had a lot of that protein, maybe the number is maybe 700, but they have so much protein that their free is really low.
It is, and that's what we see a lot.
So that's tricky, because if a lot of other providers are only looking at the total, they say, look, your testosterone is not anywhere near low. You are fine. But they're not looking at that really important free number.
And we see that a lot. They'll come in and their free testosterone will be very low, and they have to be pushed higher. And once you get them over that critical threshold, they feel amazing.
Interesting. Do you see a lot of people with that high protein where they have to go up pretty high?
No, I would say it's about maybe 30%.
Okay.
The interesting thing is, why won't we just try and lower that protein to make the testosterone better?
Yeah.
Well, there are some things that can do that. exercising more does, eating less preservatives, eating cleaner foods, certain supplements like boron help lower it. But it's not a magic bullet. You can't take someone who, say, has a testosterone of 700 and a very high protein, give them a couple of supplements, lower that protein down, and now they have an amazing free testosterone. It doesn't work that simply. So it's kind of a process because most of those people are already out of shape and have been feeling better. So we're trying to get them back into that. But it kind of becomes irrelevant really, because as long as we're moving up and keeping an eye on that, that's all that really matters. So it's really just a relative term and relative thing that we look at. It's sort of like some people like a lot of salt, some people don't like a lot of salt, as long as we're dialing it in for that person and not getting crazy and not just treating everyone the same.
Right.
And that's the thing, because the people who have a low amount of protein don't need that super high level. They're going to have extra side effects. So that's the thing that we want to monitor. And that's really what's important with testosterone therapy. It's not only just initiating the therapy, but monitoring it and keeping a close eye on it.
Well, what kind of side effects are there when you're doing testosterone replacement?
Well, I think there's a couple of things that happen from when you first start testosterone to once you've been on it a while. So the first thing that happens when someone first starts on testosterone, if theirs is low, is most people are going to gain weight. And they're like, oh my gosh, I don't want to gain weight.
Fat?
No, they do not gain fat. What happens is it activates the muscle fibers to start growing. And it brings a substance called glycogen, which is an energy source, into the muscles to start preparing them for activity. That glycogen then pulls in a little bit of fluid. So at a cellular level, there's a little bit of swelling. That swelling you can't see. They don't have swelling in their feet or anything like that. But it translates to a couple of pounds on the scale. And so what that means is, people are going to see themselves gain a little bit of weight. Generally, that weight starts to then convert into muscle as they've been on it for a while. And so that's not really a problem. In fact, then they start burning more fat. So they're not going to gain any weight from that.
And when you say they gain, you said just a couple pounds.
Varies. Some people gain 1 to 2, some people gain 4. It's about
Okay.
Yeah.
Okay.
They're not going to gain 20.
Not
if they're
fat.
gaining 20 pounds, they're doing something else.
Yeah. So it's not going to gain any fat. One more question before we wrap it up is we've talked all about men. I would like to just touch a small amount and then make our next video about women. Do women get testosterone therapy?
Absolutely. And it's just as common as men, if not more.
Really?
And it's just as important.
Okay. And basically kind of the similar ways that men get it?
Yes.
Okay.
Exactly the same.
Great. So our next video will be all about women getting testosterone therapy and why they should get it. And that's it. Anything else that you wanted to add?
No, as I said, testosterone is very safe and it's been used for a long period of time.
Awesome. If you have questions, go ahead and comment below and we will try to answer them. Thanks for watching.